Hi, welcome to Coffee and Conversation. May is Allergy Awareness Month. I'm here with Dr. Doucet, and we're going to talk about anaphylaxis. It's something we talk with our patients about when they come in, but sometimes they have different questions and things that they need clarified, so we're going to talk about that today and hopefully help some people out. Dr. Doucet, what is anaphylaxis?
So anaphylaxis is an allergic reaction that your body can have to something either in the environment that you're breathing in or something that you're eating. And our interest in talking about this topic is we manage allergy patients. We do allergy immunotherapy with shots and immunotherapy with drops. And so anytime we prepare a patient to start immunotherapy, we always give them an EpiPen and we talk about anaphylaxis and when you would use the EpiPen. But I think it's a topic that's worth discussing more broadly because sometimes you have a reaction and you're not on immunotherapy and you haven't seen a physician that's managing your allergies yet. So the basic description is a reaction that your body is having to something that it perceives as foreign, and anaphylaxis can be significant because it can lead to serious complications. And so the more awareness that we can share about what anaphylaxis is, the more people can be prepared to either prevent, treat, or at least be able to identify the symptoms of anaphylaxis.
Okay, what are some of the symptoms of anaphylaxis?
So it can start off as a warm feeling on the skin. It can make you feel hot. Sometimes initially it feels like your heart is beating fast, but then it can lead to low blood pressure and low heart rate. Most people describe it as a feeling of impending doom. They feel like something bad is about to happen, but they don't necessarily know how to describe it. Right. It can be an overall itching on the skin. It can be overall whelps to the skin. Of course, you can have nasal congestion, sneezing, a cough that just won't stop. You can feel like your tongue is getting swollen, trouble swallowing. Some people just feel like, I feel like every time I swallow, it's hard for things to go down. Right. And it starts to come on within about 20 minutes. It can last for several hours, but usually those first few symptoms tend to progress pretty quickly, and that's what leads to a reaction that can be more significant.
Okay. And what are some causes of an anaphylactic reaction?
So some people know that they're allergic to certain things. Like if you had a test for allergies and you know you're allergic to peanuts and you eat peanuts, or you might not even eat the peanut. You can smell or inhale the peanut antigen, and that can cause a reaction. But it's usually either foods or something in the environment that you get exposed to that causes you to have the reaction.
Okay. And how can you prevent a reaction?
So if you have allergies in general and you're following a physician for your allergies, typically you'll be tested for both environmental and food allergies. So the best way to prevent an anaphylactic reaction is to avoid the things that you know would cause exposure.
Right.
But for many people, they've maybe not had significant signs of allergies, and so they only get the reaction once they've been exposed to something that they weren't aware.
Right.
And it's tricky because, especially with a food allergy, it doesn't always follow a specific timeline. So people will try to say, oh, what did I eat today? Or 2 hours ago I ate this. But food doesn't always follow a timely, not like you had it and then you had the reaction immediately. So sometimes it could be a day before. Sometimes it could be because you have environmental allergies and your body is already holding on to a significant amount of inflammation. Right. Then you eat a food, and maybe you're not specifically allergic to that food, but we do know that some foods cause histamine release. Mm-hmm. So if you eat a food that causes histamine release when your body's already on full alert from environmental allergies, right, that can then trigger a reaction. Okay. So one of the best ways to avoid an anaphylactic reaction is if you feel that you have a sensitivity to certain foods, don't ignore those signs. Go in and get tested so that we can determine, is it the food, is it something in the environment? And then, of course, if you know that you have a sensitivity or you've had a reaction in the past, to have the medications with you that you need to treat a reaction so that you can prevent it a small allergic reaction to turning into an anaphylactic reaction.
And what are some of those things that you would need to treat an anaphylactic
So,
reaction?
of course, an EpiPen. That's the biggest thing that stops a reaction, a small reaction, from becoming a severe reaction, is the EpiPen. So, antihistamines always help. You know, people will say, "Oh, I started to get a little itchy in my throat, so I took a Benadryl." A Benadryl can block the histamine. A Benadryl won't stop the more serious reaction, but it can often buy you time. But certainly if you know you've had anaphylaxis in the past, having an antihistamine on hand helps. The quicker the epinephrine or the EpiPen gets into your system, the quicker you stop the reaction from being a more significant reaction.
Right.
So having an EpiPen is really the key treatment for an anaphylactic reaction.
And if you're having to use your EpiPen, you need to be on your way to the emergency room.
Go into the emergency room. So I'll often tell my patients, if you think you need to use the EpiPen, use the EpiPen. So if you use the EpiPen and you didn't need it, so say you get to the ER and they say, oh, you know, it's just a mild reaction.
Right.
It's not going to hurt you. It is, you know, epinephrine is actually a substance that's made in our systems regularly. If you use it and you didn't need it, you might experience some jitteriness or nervousness or anxiousness, but because it is considered a stimulant. But it's using the epinephrine is not, the risk of using the epinephrine if you didn't need it is much smaller than the risk of the reaction progressing.
Right.
So if you use the epinephrine, you should be driving to the emergency room, because sometimes it'll block the immediate reaction of anaphylaxis, but an anaphylactic reaction can also have a delayed onset. So you can have initial symptoms, use the EpiPen, feel like you're getting some improvement, and then within 4 to 12 hours you can have a relapse or of symptoms. And so if you use it, you should be going to the emergency room so that you can let medical professionals guide your care at that point.
Okay. And what about children at school? I know they typically, if they have an EpiPen, they'd like to keep one at school and they have an action plan.
Yeah, so most schools are, you know, that have a nurse or teachers that are involved in the care of children are familiar with EpiPens. And I recommend to any parent who has a child that has an EpiPen that not only they bring the EpiPen to the school, but they talk to the teachers that will be involved in observing their children to just go over with them, you know, here's the signs of an allergic reaction, you know, where are the EpiPens kept?
Right.
Does the school have a written action plan? Because, you know, if you've ever had to use an EpiPen, it's often a you know, anxiety-provoking situation.
Yeah.
And so you hate to have people trying to figure out what to do in the middle of an emergency. So I tell parents, you know, when you pick up the EpiPen, watch the video on how to use the EpiPen. Have the grandparents and the other siblings and even the friends watch the video, because if someone has to use the EpiPen, you hate for them to be thinking about it for the first time in the middle of a reaction, how to use the EpiPen.
Right. Okay. And when would you use the EpiPen? What are some key signs that you would?
So if you feel as though you have swelling to your airway, difficulty swallowing, progressive symptoms, itching to your palate that doesn't get better, shortness of breath, clearing your throat, or a cough that's getting progressively worse. In patients who have had an EpiPen, I think the most common phrase that we hear in patients who've had a reaction is just a feeling of impending doom. Like you can feel on the inside that the reaction is brewing.
Mm-hmm.
Now, when it comes to a child, they often will report symptoms using those descriptive words,
Right.
but swelling to the lips, swelling to the tongue, a cough that's not getting better, you know, a rash, warm skin, that's the symptoms are you know, getting progressively worse. That would be the time to use the EpiPen.
Okay, great. And if you're not sure whether to use it or not, like you said earlier, it's best to use it than not to use it. Correct.
So what makes the difference in a reaction being a small reaction versus a big reaction is how fast the epinephrine gets into your system, not how fast you get in front of the doctor. So a lot of times people will call and say, I'm not sure whether I should use the EpiPen, or I'm not sure whether I should go to the ER. So the sooner the epinephrine gets into your system, the sooner it can start to block the reaction and prevent the reaction from being a more significant reaction. So, if a patient calls me and says, I'm having symptoms, I'm not sure whether to use it, I say, go get the EpiPen, administer it right now, and start driving to the ER. So we don't want you to be in a situation where you're trying to make decisions on your own about whether the reaction is significant. If you think you are having a reaction, use the EpiPen, drive to the ER, and let someone who has medical experience help to guide your decisions, because we know these reactions can quickly turn into severe reactions, right? Difficulty breathing, respiratory distress. So use the EpiPen and start driving to the emergency room.
Okay. All right, well, thank you for joining us for Coffee and Conversation, and if you have any questions, just please contact us at the office.